it's a sort of back and forth process when you have preliminary results, presenting it, and then back and forth, see if they agree, see what it means. So they're involved with the interpretation. And the results, because of the process of participatory evaluation, it often builds ownership in the results, and especially with the positive results, and then of course with other results, can use it to help to continue to improve the project. It's often a process that sometimes becomes indefinite because of the investment in time, sometimes connections. Sometimes even when the grant funding ends, there's sort of a feeling that you just kind of want to continue, because it just doesn't seem appropriate to just suddenly stop and go away and say, okay, the funding is done. So often there's some sort of continued ties and connections with the project. So I'm going to present 3 different research projects that I'm involved with at different phases that involves community participatory approaches. The first project is called the Pacific Center of Excellence in the Elimination of Disparities. The principal investigator is from Halifax, and he's with the Department of Family Medicine and Community Health. And I am the evaluator of the project, and the Department of Public Health Sciences is the evaluation unit and conducts the evaluation for it. Kunam Bin is actually the evaluation assistant of the project. So the Department of Family Medicine currently has 3 Pacific Cancer projects funded by the CDC that have been ongoing for the past several years. The newest project is the Pacific Seed Project, and it is another CDC project as a Center of Excellence in the Elimination of Disparities. So the evaluation framework is again employing community participatory approaches, involving and working with the stakeholders in the U.S. Pacific Islands. And just to, for those who aren't familiar, the U.S. Pacific Islands are these areas. I have to look twice. Somehow didn't look right, but usually there's abbreviations, so I spelled it all out so it didn't look right. But those are the U.S. Pacific Islands. This is sorry, not a very good map, but it gives you an idea of the location and where it is in relation to Hawaii and in relation to Asia. So it's spread over this square miles, almost 8.5 square 8,500 square miles, 5 time zones, international dateline, and significant health disparities, with cancer being one of the main health disparities. And some of the reasons, lack of culturally appropriate health services, given that there's challenges to the health infrastructure in those areas, are very underserved resource-wise, both financial resources, material resources, but also personnel in terms of the number of qualified personnel, as well as being able to find people who are adequately trained because they're very isolated. And Western health systems may not be appropriate and responsive to some of the issues faced. So the goal of Pacific Seed is to reduce cancer disparities, and with a particular focus on breast and cervical cancer. So the evaluation approach, right now, since it's been less than a year in operation, we are currently working with through comprehensive cancer control coalitions in each of the jurisdictions to develop a framework to evaluate seed. So the coalitions are at the community level in each of the jurisdictions, and the coalitions are formed to specifically address cancer using community approaches. So we're working through the coalitions. We conduct tailored site visits to each of the jurisdictions. And so the site visits involve usually 2 main areas. I previously talked about training and working with the communities to do their own evaluations. So there's TA involved for them to not only conduct their own evaluation, but to again help them identify outcomes that are most relevant to them. And the other reason why we conduct a tailored site visit is to also get feedback from them in terms of identifying appropriate outcomes for the overall seed project too. And at the same time, not only evaluating appropriate outcomes, but trying to identify methods too. So we may have the outcomes, but now we have to figure out what are the best methods to evaluate it, and they would be the ones to know how. And then we also conduct evaluation workshops and meetings here in Hawaii, again with the same purpose. Sometimes if it's topics that are less tailored, then we have them come here and do the trainings. A little bit logistically difficult, as Kulan would attest to sometimes, but very necessary. But again, it's a slow, involved process. And this is just the diagram of the coalition. So there's 10 jurisdictions, and each of the jurisdictions have a coalition. So lesson learned so far is that that we've realized the need to identify culturally tailored approaches to monitoring and evaluating their cancer projects. And because of the limited access to official health data of any source, the evaluation results and data might involve more documentation of success stories by more qualitative methods. We're talking to the participants of programs or to the coalition members, because their data sources are just very limited. And this success story was actually recommended by CDC, the funder, when I met with the program officer. When I started Kulan and I tried to identify baselines related to the different cancer outcomes, and realizing that they don't even have baselines, so how do we evaluate? So already seeing some fear in, there's no baseline, how are we going to show success? So talked to the program officer, and he recommended, well, at this point you might just want to have success stories. But at the same time, one of the other cancer projects is to help develop a systematic data system and data registry. So hopefully, in the future, there'll be more of systematic data sources in these areas. Again, trust and relationship building are key in every phase of the evaluation. And in this case, because of their history, particularly trust and relationship building is required, and using community-based approaches also shifts the relationship, because we're employing these approaches. It shifts the relationships and continues the trust building to more collaborative approaches. The next project is Hui Malama Kikai, which is a local project here in Waimanalo. And just some acknowledgments of people who have been involved in the project. This is a project on the back end. This project has been in operation for the past 9 years. And these are some of the people who have been involved in the project throughout the 9 years. The main funding source for this project has been the U.S. Department of Education.